Hello, welcome back to Physician Career Guide. I'm Dr. Sherry Clarke, and I've been a medical educator for over 20 years, and I'm going to tell you what to expect now that you've matched. Congratulations on matching to a residency program. Now I'm going to tell you what to expect. First off, the onboarding process begins first thing. You're going to actually have an email that comes from the program that will welcome you to the program, and it might even have the contract in it. They have 10 days to get you the contract so that you can look it over, sign it, and send it back. Now, please be aware that this is not a contract that you can negotiate. This is something where you're simply looking at your own information and making sure that it's correct and that everything is correct from your understanding of what the salary would be to what your level would be, what your program is, and making sure that your name is correct on it. There is no other negotiation that you can do. This should not be significantly different from the contract that you actually received when you were doing the recruiting process for the program. The dates of the contract may or may not be different than you expect. So generally, the contract will be from July 1 to June 30th of each year. And every year you'll get another contract that goes from July 1 to June 30th. Now, if you become off cycle because you have a leave of absence, then your dates might change. But in general, you'll have July 1 to June 30th. Your institution may add your orientation to your actual contract. They don't have to, but that is a possibility that they could do. And so you'll have usually a week of orientation prior to July 1 start date. So you'll have orientation, and then July 1 would be when you actually start your clinical rotations and begin your residency program. You should be paid for your orientation time. So your contract might start with orientation because that's when you go on payroll, but your contract might be July 1st with your payroll date being the orientation start date. Please pay very close attention to the date that you actually have to report for orientation. Sometimes that orientation may include additional training that is optional for those who don't come with those certifications, such as BLS and ACLS. So if you already have that certification, you can provide proof of those certifications to the program and will not have to arrive early to be able to do the training at the hospital. If you don't have those certifications or your school doesn't provide those certifications to you, you can then do those certifications either online ahead of time or at the hospital before the orientation or as part of the orientation. So make sure that you're aware of what the expectations are for additional certification training and what the expectations are for you to arrive before or after orientation if you need those trainings. In addition to additional certification training, you'll have other work that you'll have to do prior to your arrival to orientation. This would include things like filling out applications for your state license, getting your national provider identification number, what's called an NPI number. Maybe you have to have fingerprints done for your background check. Those are all things that are expected of residents that they can do from their location prior to arriving at orientation. If you haven't put in your application for license and NPI prior to arriving, you will not be able to start on July 1. So the coordinators will often communicate with you about what those expectations are, and many times will even provide you with all of the information and the forms that are necessary for you to take care of submitting those applications. Some programs will submit them for you if you fill them out and return them, and other programs will expect you to submit them yourself. So please make sure that you are communicating with your program coordinator about expectations. Many programs now actually have an online onboarding process where you are expected to upload documentation so that it will automatically be put into your file. You might have a checklist that's provided to you electronically for you to be able to go step by step and make sure that all of the documentation that's necessary has been taken care of. The program coordinator will provide this information to you, and if you have the electronic option to be able to upload the documents, that is a great way of doing that so that you don't have to worry about mailing things back and forth. Now, it might seem very strange to have the HR people call you and offer you a job, but actually, this is quite often an expectation that even though you have matched and you are obligated to have that position and the institution is obligated to provide that position to you, you have to go through the HR process. Often that is being offered a job, accepting the job, and then going through any pre-hiring requirements that the institution has. Now, please be aware that even though you have matched, you don't automatically get the position at the institution unless you meet all of the requirements for hiring. So institutions might have requirements for drug testing. They might have a physical that you have to do. You might have a limitation on being able to have smoking or marijuana in your system. So these are things that you need to make sure that you're aware of and that you can meet and exceed the expectations of the institution. Quite often when HR calls to offer you the position, you have a set number of hours to be able to report to a place locally where you can have your blood drawn or your urine done for a pre-employment screening. If you don't meet that deadline, there might be consequences. Or if you do not meet the expectations of the pre-employment screening, you may or may not be able to start the position. I have seen residents dismissed from positions prior to even beginning for multiple reasons. One of them is that a felony might come back on the background check that was not disclosed prior to the application process. Or maybe a drug result comes back where there's marijuana in their system, or for those who look for nicotine, there's nicotine in their system. And so that would actually limit them from being able to start their position. You can't use excuses like, oops, someone fed me a cookie as a joke, and so therefore that's why I had marijuana in my system. That unfortunately will not fly. And unfortunately, I have seen residents lose their positions for something so simple. Please be aware that even if the substances that are in your blood are legal in the state that you are currently residing, or maybe in the state that you will be doing your residency, the institutions have the right to identify that they do not wish to have these items consumed by their employees. So even if marijuana and smoking are legal in your state, the institutions may choose to not hire you if you partake in those items. Now's the time to think about housing. Where are you going to live? Do you know the surrounding areas around the hospital? Do you know if you have to be within a certain amount of time from the hospital? Think about this. If you are in a program that allows the upperclassmen to take call from home, but has a limitation as to how far you can live from the hospital, that's something that you need to be thinking about now so that when you have the opportunity to take call from home, you're not living too far away. You need to think about where you are looking for housing compared to where the hospital is and what the transportation looks like. Is it a busy commute? Is it an issue where you would have to hit multiple buses to be able to get into work? Is there public transportation that is simple to be able to get from that location to the hospital? Or is there a road system that works well for getting you back and forth? A great way of finding out the areas that are most beneficial for the residents is to talk to other residents about where they live and where their peers live, and see if you can get recommendations as to best areas or maybe even the best apartment complexes to move to. In addition, you might consider buying a house, and there might be times that graduating residents might be selling a house. So the GME office may be very well aware of opportunities that would be beneficial to you to be able to find good quality housing in a nice area. Remember, in your first residency year, you're going to be going in and out throughout different times of the day and night, many times coming and going from your housing in the dark. And so you need to be aware of the safety of that area and make sure that you are not putting yourself at risk by being in an unsafe area. I had one resident who looked at the apartment online only and didn't even consider the safety of the area. And then when he arrived, he was uncomfortable with the conditions of the neighborhood. Unfortunately, he already had a 1-year lease, so he had to deal with the fact that he was in an unsafe neighborhood for an entire year. Please be aware of the safety of the location so that you can ensure that that's not another element of stress that you're adding to your first year. In order to get a lease or a mortgage to be able to move into the area, many times you're required to provide a letter of employment that shows your salary and the length of your contract. So there's two ways of doing that. First off, you could provide your contract, which quite often is multiple pages and a lot more detail than the person that you're going to be renting from or your mortgage company is interested in having. Or you can simply ask your program coordinator for a letter. They do this routinely, and it is not a problem for them to provide you a letter that has the details of the information that you need to have for the mortgage company or for the rental organization that you're getting your apartment from. So feel free to contact your program coordinator and request this. Hopefully this helped you understand a little bit more about the timeline and expectations right after the match until you arrive for orientation. Make sure that you're checking your email daily for updates from your program coordinator and making sure that you are responding in a timely fashion to all of the requests for data, documents, and information. You might also have to do some online training in one of their systems to get some of your training that used to be a part of orientation but can now be done online out of the way ahead of time. So just keep an eye out for that. Make sure all your logins work. If you have any issues, your program coordinator is definitely the person to call. They're there to help you be successful. So make sure that you build that relationship and make that connection right now, because you're going to have that relationship throughout your training and they will be a very beneficial ally to have on your side. If this video was helpful, please like and subscribe, and we will be talking next about what to expect when you arrive for orientation. Thank you, and once again, congratulations for matching.